Hi, welcome back to the Ocean Township Preschool Podcast. My name is Taylor Gilman. I'm the Preschool Intervention and Referral Specialist, and I have today with me Dr. Sami, a dentist, as well as our Director of Preschool, Mrs. Vona. And we're just going to talk a little bit today about pediatric dentistry, going into, Dr. Sami has a lot of great information for us in terms of when to start seeing the dentist, stuff like fluoride, anxiety about going to the dentist, all that great stuff. So I'm just gonna.
Can I just interject really quick?
Yeah.
I think this is a great way for parents to really, whether you're looking to bring your 3-year-old to the dentist or you have a younger child at home, maybe some tips and strategies as well to help parents understand more about the dentistry aspect of preschool.
Yeah, no, that's great. So my name is Dr. Minahil Sami. I received my Doctor of Dental Medicine and my Master's of Public Health from the University of Pittsburgh. And ever since, I've been working in public health. I work at an FQHC right now. I work with VNA, so I serve communities in Freehold, Asbury Park, Red Bank, and we see a wide range. We were talking before, from 0 to 100 patients everywhere. But I do love seeing my kiddos, and I think this is a great opportunity because I've talked to kids before, but this is my first time really talking to the parents, and I'm excited to be here today.
Yeah, thank you so much for coming and joining us. I think it'll be a lot of really great information. So I know that you have a little bit of a presentation, which I think we're going to try to link to this video as well in the description, and I'll just kind of let you take it away.
Great. So when we're talking about going to the dentist, parents ask, when should I bring my child to the dentist? So we recommend establishing a dental home before the first tooth erupt. So like by age 1, it's good to bring kids to the dentist. And why are we doing this if they only have one tooth? Well, it kind of comes down to reducing dental anxiety. So we really want this first visit, although we're not taking x-rays, we're not doing, a lot of things that we do with older children. It's really to get patients adjusted, letting us take a look in their mouth, having like a happy visit. And that first visit for me is sometimes more targeted at parents too, so I can talk to them, set expectations, what's going to happen, and more about like oral hygiene. So that's kind of what we recommend, just before age 1.
Wow, that's great. And a lot of people might not even realize that. So I'm glad that you kind of explained a little bit, especially the aspect of parents, anxiety parents might have as well, because besides the children, a lot of parents, have never experienced taking a child yet. So that's a great way of looking at it.
Yeah, definitely. And I don't have children yet myself, so I wouldn't even think to know of when to go. And I think it's really great that you mentioned, just getting them comfortable with it at first, right? Just showing it's not a scary place. And there's a lot of noises and stuff, but it's all good things. I'm sure they leave with a sticker.
Yeah. Dental anxiety is a big one. So a lot of my adult patients, they come in. No one loves to go to the dentist. I hear that a lot. But a lot of it stems from their childhood, right? Like you hear dental anxiety comes from, I had a bad experience when I was a child. So these first visits, we really want to make positive, leading forward in their life. So like a good way I tell parents is go to your local library. There's a lot of books out there, going to the dentist, the night before the dentist. These stories can help set expectations. We're not some scary place, So that is also a helpful tip for new parents coming in to seeing us.
That's great. I saw one of the things that on your presentation was about toothpaste.
Yeah.
Can you tell us a little bit about that? Because I know some parents aren't sure, do you introduce toothpaste right away? Just kind of give us an overview on that.
Yeah, so great. That's great. Oral hygiene, jumping into it. So we recommend for toothpaste, it's really important. So kids at a young age, we know they might not be able to rinse out as we adults do, right? So we limit the amount of fluoride toothpaste specifically. So if they ingest it, that's okay, right? So when we look at children 0 to 3 years old, what we recommend is a smear. So if you think about the size of a grain of rice, that's kind of how much toothpaste we want to give. And then once they're in the age range of 3 to 6, we can graduate to a pea-sized amount of toothpaste.
I never knew that. I'm learning so much.
It's a good visual for parents too.
Yeah, definitely.
And so brushing teeth is important as soon as the first tooth erupts. It's something to get kids used to. And a helpful tip that I like to tell parents is if your child cannot tie their own shoe, then they cannot brush their own teeth by themselves, okay? They don't have that manual dexterity to get through all surfaces of their mouth, so they need that guidance. A lot of the times, we love our children to be independent. Independence is great, but at that early age, we really want parents to be like the primary plaque remover for children, just to ensure we're getting a clean mouth every night.
Yeah, definitely. I know I've seen they try to do it themselves. We want that independence, but they end up like just sucking on the toothbrush at times and stuff like that instead of really getting.
And as you're talking, I'm thinking to myself, like when my kids were little, I wish I knew some of this. Like even what you said with that little grain of rice, like I might have been putting too much on or not enough, and just someone to give us this information is so helpful.
And what are some things that parents should be looking out for in terms of as their teeth are starting to come in and they're starting to get a full set and everything? What are some things that parents should be looking out for?
So let's start with teething, because that's like the first stage, right? So teething, of course, children are going to have pain. You like emotions. Again, I don't have children, but I'm sure, teething is a whole process. We really want to talk about like the do's and don'ts of teething. So do's, any sort of like wet, even like a wet washcloth, if you want to put in the freezer, like have them chew on it. What we don't want to do is these baby Orajels. So as dentists, we don't recommend them, especially under the age of 2 years old, because they're benzocaines, right? We don't want to topically be giving that to children. It can cause like a slew of other problems. So what we recommend for teething, any like safe teething toys. We don't recommend any sort of like teething necklaces. I don't know if people are still familiar with those, but those used to be put on babies. We don't recommend something like that. It could be a suffocation hazard. And then when we graduate up from teething, we want to look out for any sort of like white spots on kids. As if your kid tells you, hey, like something's hurting, bring them to, like, we'll take a look. That's something helpful for parents to take a look at. Yeah.
Definitely.
It's great. So one thing I saw also on your presentation was you talked a lot about diet and oral health. Could you tell us a little bit more about that so we can kind of...
Yeah. So, should I quiz you guys a little bit?
I hope we pass.
All right. So let's talk about some snacks. You let me know which you think are like, I'll list them out. You let me know the top 2 that you think are worst for oral health, okay?
Okay, so the ones that they shouldn't be.
They shouldn't be, but they're popular. Okay, so let's start with like cheese, nuts, fruit snacks, applesauce, and goldfish. I'll give you those 5. You tell me 2 that you think might be.
I'm going to say goldfish and fruit snacks.
Yeah, they're top 2.
That was quick.
Yeah, yep.
I definitely thought the fruit snacks, but,
right.
because of the stickiness and different things. But I was kind of struggling with the other one, to be honest.
Yeah, goldfish are very popular. So we think of cavities and oral health, we think about sugar immediately, right? We don't think about those other starches and those carbohydrates, right? But the way that goldfish particularly work, when children, it's not when you're done eating, they're still stuck to the grooves of your teeth, right? And they stay there. And it's a fermentable carbohydrate, which then the bacteria use to turn into acid, and that's how cavities form. So it's the sugars, it's anything sticky. So if I know it's not possible to like completely erase that out of the diet, but like, helpful switches. So like if you can have nuts, if you can have just mozzarella sticks, like a whole cheese, whole fruit, applesauce. So things like that are some mindful switches that we want to do.
That's
good to know, right?
Yeah, it's very good to know.
Yeah, right?
I'm going to look in my cabinets too and go.
And then another thing, which I sometimes see with my older kids, is sugar-sweetened beverages. Kids love Gatorade, they love soda, they love juices. So we really recommend limiting all of those things, especially when they're younger. Less than the age of 1, we really don't even think that you need anything other than water, right? If you are going to have any sort of like juice, we want like 100% juice, something that there's no sugar added. And when I talk to parents, I would prefer a child. Sometimes we dilute the juice so it can last and maybe it's less sugar, but it's kind of better if they drink that half cup of juice in one sitting rather than sip on that all day, right? So if you want to give them a juice, like have them drink it, and then, water to replace, everything in the mouth, and that's better for them, what we recommend.
So just so you guys know, too, also as in our district, our cafeteria and stuff, when we serve to the preschoolers, they only have a choice between water and whole milk.
Oh, that's
so
great.
Yeah.
they don't offer juice. They don't offer
Yeah.
chocolate milk at that age.
Mhm.
You know,
Yeah.
that's as they get older, but we're really trying to focus in on, dental hygiene as well
That's great to hear.
through our food service. So
Yeah.
it's just another little thing about our preschool.
That's very good. I think I grew up with a school with a soda machine, so I'm glad things have changed.
Yes, most
Yeah.
certainly. And I love that you mentioned the dilute, because I've always heard that with the diluting the juice,
Yeah.
and it makes it so much better. But I would have never thought that it's
Yeah.
kind of, in the long run, just better to let them drink the cup then and then
Yeah.
have the water going throughout.
Yeah, it's like the pH of the mouth is such an important thing. We can get into that later, but the juice, better just to drink it once and let the water kind of rinse out and bring everything back up to like a good pH in the mouth. And now that you bring up milk, I'd like to talk about another topic that I talk about parents, especially at that first visit, which is baby bottle cavities.
Okay.
So a lot of my parents, babies love to fall asleep with milk. They have that milk at nighttime. However, same thing, there's sugars in milk, and they also lead to cavities. So what we recommend is you want to, and this is where I say pro dilution, you want to start, if we want to switch over from nothing but water at nighttime, okay? But it's difficult if your baby's attached to having milk at night, how are we going to switch over to water? So starting at after age 1, we really, really do not want to have milk at bedtime. So what we can do is we can start diluting that milk with water gradually until we're completely transitioned. And that's just a nighttime feeding, because we just don't want that milk and sugar in the mouth all night with the coating the teeth, basically.
One thing that I was just kind of thinking of as you were speaking is, how many times do you recommend for parents to brush a child's teeth,
Yeah.
like maybe at the age of 3 or 4? Because I'm thinking of, if we have the apple juice and we have it straight, like, would you recommend brushing right after? Would you recommend maybe just in the morning and night?
That's a great question. So morning and night is ideal. I would love if parents can do morning and night. 3 times a day would be amazing, but I know that's not feasible for a lot of
Yeah,
parents.
absolutely.
And I think I grew up in a preschool where we did, after lunchtime, we all had our toothbrushes and we brushed our teeth, but I know that's not feasible and many times. 3 times would be amazing, but 2 times is great. And sometimes parents have, the most important time to brush is at nighttime, I would say. Not that I would like to pick one over the other. I would love morning and night, but nighttime is very, very important, because we just don't want any sort of plaque, any sort of sugar in the mouth overnight, really, having the bacteria have a party in the mouth all night long.
Yeah.
That's kind of a fun way of looking at it.
Yeah,
Yes.
it's like a buffet for them. Yeah.
Right. And was there anything else that you feel like parents should really be looking out for, or, things that they should definitely be coming in to the dentist, if they start to see signs of anything?
Yeah, so a lot of times parents come in because a baby tooth is loose and it's not wanting to come out and it's causing kids pain. So I've had little kids come in, they're like, I can't eat because I'm in so much pain. So always bring them in, you can take that tooth out for them safely as well. That sometimes parents don't know that they can do that, but I take out baby teeth all the time, just to help the parents and help the kids. There's nothing. If it hurts too much to brush or eat, we don't want that to happen. And there's a lot in the field of pediatric dentistry, a lot of change that's happening. There's a lot of treatment we can offer. So if kids do get cavities, we can do traditional fillings. We have something called SDF that I wanted to talk about. So SDF is silver diamine fluoride, right? It's a material that has been used for years and years, a lot of scientific backup, and we use this on primary teeth a lot. So a lot of times that I use this might be for my patients with special needs, children that have a lot of dental anxiety, children that can't see the pediatric dentist. So what SDF does, it arrests about 80% of that cavity, right? So it stops it from going forward. And the reason why we only use it on baby teeth is because it turns that cavity part of the tooth black. So I know that parents may not like that for front teeth, but this is a great option for back teeth, right? Baby teeth are so important. They make space for your adult teeth. So if we have to pull out a baby teeth prematurely because of cavity, there's a chance that the teeth on the side might shift over. We might need braces to bring up that adult tooth. There's just no more room for it. So there's silver crowns, of course. So there's a slew of dental treatment, that we can offer for parents if children do have decay. So.
Wow, and so that's something that I like how you brought up too, for special needs students or, students that have a lot of anxiety and different things. So there are other types of treatments.
Yeah, definitely.
Because that's huge, and especially when parents are, feeling anxiety in themselves and coming into it.
Yeah.
Yeah, definitely. Well, thank you very much.
course,
It's been
it's so
great
nice to
having
be
you,
here.
and I
Thank
think we
you.
talked about a lot of really awesome topics that I hope a lot of the parents, find helpful.
Our Ocean Township community is going to love this. So
Yes,
thank you
so
so
happy.
much.
most certainly, yes.
Yeah.
And where are you located, in case, I think you mentioned it briefly in the beginning, but if you
Yeah.
could just
I'll
mention
go
it
over
again.
Yeah. So I'm with the Visiting Nurses Association Health Group, the Health Center. I'm a float dentist, so I hop between Freehold, Asbury Park, and Red Bank. We also have a clinic in Keyport, so all 4 sites have dental care. And again, we see everywhere from 0 to 100. I love seeing my kids. Sometimes if things are out of our wheelhouse, we do refer out to pediatric dentists, but come see us if you need
Yeah.
dental care.
Awesome. Well,
Thank you
thank you
so
very
much.
much.
Of course, thank
Yeah.
you.